Good morning. My name is Ginaline Ruder. I'm a physical therapist. This short video, is just a quick free resource for people who has been hospitalized or their loved ones has been hospitalized, and they're thinking now what after, especially older adults. What are your options after being hospitalization? So it depends on your condition and what the doctor's recommendation. You may or may not have therapy while you were in the hospital. But after hospitalization, if your doctor's recommending further therapy, where do you go? So let's talk about first the key person. Social worker is a great resource to talk about what are your options. Social worker has idea of what kind of coverage you have, what kind of insurance do you have, what your insurance allows you to have with regards to therapy. So coordinate with the social worker. Some hospitals, or depending on your policy or insurance, have case managers. So case manager again have a wide knowledge about what kind of insurance you have, what coverage you are entitled to. So these are key people that you want to coordinate with while in the hospital to get a clarification. After being in the hospital, how can you or your loved ones have further therapy depending on your insurance? So there's so many factors, and I just touched on the first one. You have to consider what kind of insurance do you have. So for example, Medicare covers, the Medicare Part A. If you have Medicare Part A, the traditional Medicare, meaning it's not under Essence, UHC, or any other private insurance. Medicare Part A, it's the standard one, covers your hospitalization, and if you need to go to like a further therapy in skilled nursing facility with rehabilitation, Medicare Part A covers that. With private insurance, they cover, it again, it depends on what kind of policy do you have. They may cover your hospitalization and a short stay in a skilled nursing facility. So you have to be aware of what kind of insurance coverage do you have, because that will dictate where you're going. And if you don't know, then coordinate with social worker, or the case manager for that matter. So another is, let's talk about what are the options after hospitalization. Where can you get your therapy? So there are so many options. Number one, there's what we call inpatient rehabilitation in the hospital. So it depends again what kind of insurance do you have, and what is the recommendation of your doctor, whether or not you will qualify to this inpatient rehabilitation facilities or hospitals. And it is good to clarify that with the social worker or case manager. So some kind of people or conditions being admitted in those buildings are people with stroke, fractures of the legs, or surgeries. So again, it's hard to determine by not knowing what kind of insurance you have. You coordinate with the social service, and it also depends on the doctor's recommendation. So if you do not qualify for inpatient rehabilitation in the hospital, one of the most common option is skilled nursing facility. Now, I just want to clarify this. Many people has an notion that skilled nursing facility is for old people's home. That is no longer the case. Skilled nursing facility has a rehabilitation facility. So some of them has like skilled nursing and rehabilitation facilities, meaning they have a short term or short stay for rehabilitation. These are people who were in the hospital needing further therapy. So and they can get that from the skilled nursing facility before going home. So the amount of therapy that you will get, and the length of stay that you will get in those skilled nursing facilities are dictated by what kind of insurance you have. Okay, so you have the inpatient rehabilitation hospital, one option if you qualify. Another is skilled nursing short stay rehabilitation facility. And then if you know if some patients or some family members, they don't want to go to further therapy in these facilities, they go home. So that is one option, is going home if the doctor will recommend that or approve that. The patient can go home if the patient is safe to go home, and especially if the patient is alone. So it depends on the doctor's order or recommendation. So if the patient can safely go home and get therapy from home, so they can have home health therapy. So usually home health therapy caters nurses, nursing care, physical, occupational, speech, depending on the doctor's order, depending on what your doctor thinks you need to recover. So those are the options. And another factor to consider, so although you have many options after hospitalization, one important factor to consider is the availability of the facilities. So although you have many options, are the facilities open to accept admission? Do they have open beds? Do they have vacancy? So the social service worker or case manager usually will coordinate with the patient or the uh, POA, or relatives, power of attorney, uh, to make a decision where do they want to go. And usually if there are facilities that are open, they will give you a list of facilities choices that you want or your loved one to go for further rehabilitation. And if you don't have any idea which is good and which is not good, therapists like me, if you know a local therapist in your area, who knows other therapists working in different buildings, they are a great resource to get an advice or recommendation of which facility gives better care than others. There's no perfect facility, but there's certainly better care than others. Okay, so I hope this is helpful for you guys. Many people are not aware of what they will do after being hospitalized. The good old days of hospital going back home are typically right now is no longer the case. Most of the case, especially for older adults, there are so many factors to consider, especially if they live alone. Most of them might not be able to be safe to go straight from the hospital to home. So that's why they have a transitional stay in different facilities that I mentioned in order for them to regain more strength, confidence, and safety before going home. But depending on their condition and the status of their mind, their body, whether or not they're going to be able to safely go back to where they were before. So again, it's a team effort from the nurse, from the therapy, from the social worker, okay, caring for these patients on what is the best recommendation after therapy. So there are many factors to consider. Message me if you have any other question about this. I will be more than happy to make more videos that actually will help uh, family, loved ones, caregivers, especially of older adults, in navigating through this difficult process of health crisis or situation, and how to get the therapy that you need or your loved ones need in order for them to regain or improve their condition to the highest level possible. Okay, thank you for watching. Please hit the subscribe, share this video to anyone you think will need it, and stay blessed, stay safe.